Trying to So I think I'm live now. Um, I'm trying to connect. My network is a bit slow now. So what I'm trying to do is I'm trying to connect my screen to the streaming system, but it's a bit slow on my end. See if yeah, so you're all welcome the to this particular section. This is a live section that I'm trying to do on the mental health Osce, and today we will be going through Mania. I've had a lot of people that have asked me so many questions on Mania, so today we'll try as much as possible to go through the manic phase. As you already know, in the mental health Osce, we have two phases. We have the depression and with or and suicidal ideation phase, and then we also have the manic phase. So if you are doing your mental health OSCE, the nursing OSCE, during your assessment, which is a 20-minute station, is either you will be getting a patient that has mania or you would be getting a patient that has depression. A lot of people have seen my video on depression, and I think they've been asking for some bit of videos on the mania as well. I have the part A of the mania, which was more or less like an explanation to it, but then I'm yet to upload a practical version. But I've had so many people who have been asking it in the comment sections, and of course in via email as well. So today I have a scenario here. It's a real scenario. I'll be going through this particular scenario with you, and then we'll look at how we will be able to assess a patient with such scenario as you are seeing on your screen. So usually you have this scenario. The first one is more or less like the candidate briefing. Then you are also given what is called the overview of recent history, and then you are also given this particular sheet, which is the candidate note. So these are the documentations that you should expect when you go into your exams, and then you have if you are presented with a manic patient. In mania, they don't give a PHQ 9. So that is one thing that you should take note of. They do not give PHQ 9. So yes, we are going to go through the scenario and then we'll see how we will be able to tackle it. So as you already know, it's a 20-minute station, and here you are presented with a patient who you have to talk to do your assessment. So let's look at the candidate briefing, how it looks like. This is more or less like it gives you an insight into the kind of situation that you are dealing with. When it comes to mania, it can either be in the community setting or it can be an admission based setting. The community setting simply means that you are going to the patient house to go and do the assessment, or the patient is coming to the community clinic. In any of these two situations, it is still classified as community based. And if it is an admission base, it could be that the patient is already on admission and then you are going to do the assessment. When the patient is on admission, it doesn't necessarily mean that the patient is on a mental health ward. It could be in an A&E, in a medical ward, wherever the patient is, and then you are sent to go and do the assessment. The aim of it is to assess the patient to see whether this particular patient needs to be in a mental health ward for treatment to commence or not. and or the patient can be a resident in a care home where they've started to suspect that the patient is having some sort of mental health issues, and you as a mental health nurse, you would be sent to go there to do the assessment, and if the need be, you can also refer to some form of specialist mental health care for that particular patient. So in any of these situations, you should expect either a community-based assessment, or you should expect an admission based or a hospital base. So now let's look at this, our candidate briefing. It says that you are a mental health nurse within a mental health facility. Wilson Chloe has been referred to your ward by A&E because of episode of manic behavior on the train. Please conduct a holistic mental health assessment using the recovery model of care areas below, including patient self-care, adherence to prescribed medication. Please discuss the outcome of your assessment with your patient. Consider the current risks for the patient using the information from A&E referral and information gathered in your assessment. Use green pen to complete the station, and of course you have 20 minutes to complete this station. So clearly you could see that this is an admission base. So obviously this patient had a manic attack whilst the patient was or the started experiencing or exhibiting some form of manic behaviors on the train, and due to that, the person was brought to the A&E. So clearly you could see that this is an A&E. They've attended to the patient. So it was a general A&E that this person was sent to. They have seen this person and they are like, nah, this is more of a mental health issue. And you work within the mental health service or the mental health unit, and they've called you to come and assess this particular patient. So clearly, the patient is already on admission at the A&E, and the A&E people or the A&E doctors or whoever was there has referred this patient for an assessment. This is a clear example of an admission base or a hospital base. Now let's look at the second document that they give. They have given overview of the recent history. As you are seeing here, the patient name is Chloe Wilson. The date of birth, by the way, this is not a name of any patient, it's just for education purposes. And then the date of birth is 01/01/1987. Then we have a hospital number of 1234567. The address is 15 Mitford Way, Newcastle, NG1STL. So this is the biodata of the patient. And then we go to the presenting histories. Presenting complaint is episode of manic behavior on a train brought in by transport police to A&E. History of presenting complaint. Then we have Chloe displays impulsive, delusional, erratic behavior that concerns the husband and parent. Has been aggressive, hostile towards husband and child when in manic state and drunk. Chloe suffers with prolonged episodes of excessive energy, big ideas of becoming famous singer, delusional, uninhabited concerning behavior in public. She suffers with prolonged bouts of sleeplessness and often sleeps for only an hour or two at night for weeks. Then she has extremely long periods. Then Chloe has not had any therapy recently. Chloe is on medication for bipolar but has reported that this has not helped with current episode of mania. Chloe has a very poor appetite when she is in her manic and depressive phase and does not eat or drink for prolonged periods. So clearly this has given you an insight into the type of patient that you'll be dealing with. First of all, they are telling you that this patient was brought onto the ward when she started exhibiting some signs, some manic behaviors on the train, and then she is impulsive, she's delusional, she has erratic behavior that concerns the parents and then the husband as well. And then of course she's also been hostile towards the husband when she's manic and drunk. So clearly they are telling you that in her manic state she drinks, and then of course she also suffers of prolonged episodes of excessive energy. This is clearly hyperactivity or more like an elated mood. And then she's not been sleeping, she's not had much sleep, she doesn't eat well as well, and then her medication is not also helping. So this, the very first part of the overview of the patient history, always gives you a picture of the type of patient that you are going to be dealing with. And then when you go to the past medical history, She has bipolar diagnosis that was 4 years ago, and she also has some bit of physical health conditions, IBS, and then constipation. Then when we look at the social history, the parents live nearby and visit daily. She has an 8 month old baby, and she's been married for 6 years. She has no pet or dependent. She lives in a two-story building she owns with her husband. She was a librarian for several years and has been out of work for the last 8 years. And then because of her disability, she's obviously getting some benefits. She's a non-smoker and she drinks in her manic state. This statement is very, very important, so you have to take note of that. And then when we go to the medication history or the drug history, she's on sertraline 100 milligrams once a day, Docosahexaene sodium, and then citalopram, diazepam, and then she's allergic to penicillin, and her reaction is anaphylaxis. So now you know about the patient. What are you going to do? Remember, this patient is already on admission at the hospital. So what are you going to do? So, as usual, I've always spoken about our initial checks. Any more of the stations when you are going to start, you have to do your initial checks. So the assumption here is that the patient is already on a ward. So what do you do? First of all, after reading your scenario and now you understand the type of patient and you know the situation, you know that it's a hospital base, what are you going to do? You're going to start off with your initial checks. So you're going to enter into the scene, then of course you check for scene safety. The scene is safe to approach. Then you do your hand rub according to the WHO guidelines. By now, everybody should know how to do the hand rub. I have a video on that. So you put an ampoule of gel in your palm. You do your palm to palm, palm to back, fingers interlace, fingers interlock, fingers interlock, rotational rub of the thumb of the fingertips of the fingertips of the wrist. Then your hands are clean and dry to approach. So at this time, you approach your patient. Once you approach your patient, then you introduce yourself. So in this case, I'll just introduce myself as I am Enos. I'm one of the nurses at the mental health department. And as per the referral by the A&E team, I am here to conduct a mental health assessment for you. Are you happy for us to do so, or is this a good time for us to do so, or are you willing for us to do so? Then at this point, the patient is going to respond, yes, I'm happy for us to do so. At this point, you can ask the patient his name, her name, and then the date of birth. So please, can you tell me your full name and then your date of birth? And then the patient is going to tell you, my name is Chloe Wilson and my date of birth is the 01 of 01 1987. Do you know your address? The patient is going to tell you whether he knows. She's going to tell you 15 Medford Way, Newcastle. So at this point, you have the document in your hands, you read it back. So I have with me here Chloe Wilson, hospital number 004321, address is Medford Way, Newcastle, NG, STR, and then the date of birth is the 0101 1987. Assessor, I can confirm that I am with the right patient. So at this time, you've confirmed that you are with your right patient. Then the next is to sit down. So at this point, mostly they make provisions for chairs. So you pick your chair and then you are now going to sit down comfortably. When you are sitting down, you observe the solar position. So you sit upright, you sit towards the middle of the chair, so that you are not so close to the edge of the chair, and then you are not also so relaxed on the chair. So you sit with an upright position, you do not cross your legs, and then you make sure that you maintain eye contact with the patient without unnecessarily staring. And then one thing you also need to take note of is if there is no table between you and the patient, do not sit so close to the patient. There was somebody that went to take her exams, and then in a report they stated that she was so close to the patient, she was invading the patient's personal space, which was so intimidating. So you don't have to sit so close to your patient that your legs can easily touch the legs of the patient. If you do that, that is more intimidating. You are invading the patient's personal space. So you try to maintain at least an arm's length. So when you stretch your arms, at least the patient should be at the other part of your arm when you stretch out your arm so that your sitting wouldn't be so intimidating to the patient. So once you've sat down in the solar position, now it is time for you to start off with your assessment. So in this case, they have already given us everything that we need to know about the patient. But of course, it is an assessment that we are going to do. So we would have to talk to the patient. We'll have to get answers from the patient. And then at the end, we'll try to look at the risks that this patient is posing and how we will be able to help this patient. So at this point, you can repeat it to the patient. So as I said earlier on, my name is Enos. I work in the mental health wards, or I work with the mental health department, and I'm here to conduct a holistic mental health assessment for you. So at this point, you can be very open. Um, you can ask the patient, do you want to be called Chloe or you want to be called Wilson? The patient will say, oh, just call me Chloe. At this point, you can put it to the patient. So, Chloe, would you be willing to tell me what has been going on? Remember, this patient is already in a hospital. Or some people might start off with, so Chloe, do you know the reason why I am here to see you? Or do you know the reason why I came in here or I've been called in here? Or do you know the reason for your referral to the mental health team? If you say that, sometimes the patient might tell you, or you can just go straight forward and ask the patient, Chloe, are you willing to tell me what has been going on? And then remember that this is like a synopsis of what has been going on, but the patient is definitely going to have a backstory. In this case, mostly if the patient has, let's say, an 8 month old baby like this, they can start off by telling you that everything was going on well. I've been with my husband for the past 6 years and we have been living life together. We have always been dreaming of having a baby, but then we didn't want to have it immediately. We wanted to wait till the 6th year in our marriage before we have a baby. And yes, I've had a baby now, which is 8 months. When I was pregnant, we were all anticipating this baby. But immediately after giving birth, I don't know what happened. All of a sudden, my previous or my diagnosed mental health, my mental health diagnosis that I was diagnosed 4 years ago started to kick in. I started thinking about, being the best or being the best singer in the world. Alcohol became something that I normally take. I normally drink a lot of alcohol, and things have never been the same. Anytime I'm on the public transport, it happens. And this morning, exactly what happened, I was on the train, and then all of a sudden, by the time I realized, I was kind of restrained and brought here to the hospital. So I'm guessing that is the reason why you are here to see me. So the patient has already given you a backstory. And at this point, remember, this is the sheet that you are going to use. At this point, the patient is more or less telling you about his or her life event. So at this point, what you can do is that when the patient is talking, the patient has already told you that in her manic state, she takes alcohol and she can be hostile. You've put that one down. It was what actually kick-started this whole thing was childbirth, and you know very well that when patients, some women put to birth, they have postpartum psychosis, and this could be a trigger, especially when the patient has ever been diagnosed of bipolar. Once they give birth, the manic state can start to kick in, or the depressive state can start to kick in. And clearly, this lady is telling you that it is when she gave birth that this whole behavior, or this whole manic behaviors started. So at this point, you know the cause of what is causing her manic symptoms. So at this point, when she has told you, you can go ahead to ask her, so in this situation, is there anything that you do that makes you feel better? Then the patient is definitely going to tell you, when I do ABCD, it makes me feel better. After exploring that, you can go ahead and explore the relation. Remember, we are using this sheet. This sheet is supposed to guide you to be able to ask the relevant questions. So at this point, you can go ahead and then you can ask about her relationship. So in this situation where you have a baby, you have a husband, you have a family, and right after birth, you've started exhibiting these signs, which you yourself have acknowledged. How have this affected your relationship with your baby, with your husband, and with your family? And here the patient is going to tell you exactly. Here they've stated clearly that when she's in the manic state, she takes alcohol, and then she can be hostile. So at this point, probably she's going to tell you that, well, my relationship with my husband, my baby has not been a good one. This is a baby that we were expecting. We're all happy, but in this my manic state, I do take alcohol, and at a point when I took it, I became very, very hostile to both my husband and then my baby. So the person will tell you exactly the relationship that has gone on between in this particular situation that she's in. She's going to tell you the relationship between her and then whichever family that they may have, and that is the family she has. When you read the social history, you can see that she has an old man baby and then a husband as well. Then at this point, if you finish with the relationship, you can also ask about her relationship with the other family members. How is it going? Have they been supportive in this case that she has a baby, and then she's struggling with her mental health? How has her parents or her other family members been helpful? Have they come in to step in to try as much as possible to help her and the baby? Try to explore. So don't just ask about the relationship between her and then the husband, and then that is it. Here, there is a baby at stake. So mostly you will see that the scenario or whatever you are with the questions, the relevant question that you have to ask is normally based on the scenario and then the history that they gave you. Here there is a baby at stake, and anytime there's a baby at stake, you have to ask the relevant questions. A parents, a husband, how have they been helpful in this situation where there is a baby? And then she's going to tell you a whole lot about her relationship. Then when you come to living situations, here clearly you could see that she'll be having some difficulties with living situations. Already when you read here, they have said that she's not sleeping, she's not eating, and then she kind of stays, she has this excessive energy that she kind of just moves around. So imagine a mother eight a mother of an 8-month-old baby who has this excessive energy and then is moving around. Just imagine how she's going to handle the baby. These are things that you should ask around when it comes to the living situation. So at this point you can ask her, so Chloe, I can see that you have an 8-month baby. How has things been with you and then the baby? Then most definitely she's going to tell you, I'm thinking of becoming the biggest singer. If you read it, it says that she has this delusional thought of becoming a famous singer. So honestly, I've not had time to for my baby. It's mostly my baby is with my husband. So clearly, this her manic symptoms is not even making her giving her that time or affording her that luxury of catering for the baby. And then you can also ask, there have been periods where you've been moving around a lot in the house in such a state. How do you handle the baby? And then most definitely they are going to give you um, you know an answer which might suggest that which might suggest that she's being a bit hostile to the baby as well. Then you can also ask about her sleeping pattern. I have clearly seen that from your notes you've not been having enough sleep. How long has this been going on? She's going to give you an answer. What do you think doesn't make you sleep? Or you just explore further to ask the reasons why she's not sleeping. And then of course she's also going to tell you about that. Then when it comes to self-care, you can ask her questions on things like personal hygiene. How has her personal hygiene been? Whether she's actually taking care of herself in terms of her personal hygiene, and then it can even go a long way to extend to the baby. Whether she's bathing the baby, if she's not, who is doing that, or nobody does that at all. You have to ask questions around her, and then because here it is patient self-care, but here it extends to the baby because clearly the 8-month-old baby is dependent on her. So you also have to ask about the welfare of the baby at this point. Then you can move on to the non-adherence to medication. So here it is also stated that she's on some form of medication she's on some form of medication, but then the medication is not really working out. So at this point, you can ask her, Chloe, I can see that you are on some medications for your mental health. Do you know the medications the patient is going to give you? These medications that are here, sertraline, diazepam, and then the glucose. Some patient might be able to give you, some might not be able to give you. Some of them will just tell you that I don't even remember the last time I took the medications because they are not really helping me. I've been taking it and it's not really helping me. So at this point, if the patient is going in that direction, you know that the patient is not taking the medications, and then if the patient is not taking the medication, you try as much as possible to also explore the reasons why the patient is not taking the medication, and then you try to put all those points down here. Now, after exploring all to this point, in a mental health situation or in this assessment situation, whether it is depression or whether it is mania, um, you also have to explore the question of self-harm. So at this point, you can also ask the patient whether the patient has been having any thought of self-harm. And if the patient is having thoughts of self-harm, how often does he or she has this thought of self-harm? And then you can even go a long way to ask whether they have a plan. But mostly in manic state, patients don't even have time to even think about the they don't even have time to think about suicidal thought, unless probably they fall back into the depressive phase. But on some rare occasions, you might have some patients who have thought of self-harm. Then, so at the end of this, you realize that it started right from major life events, then it went back to relationship, then it came back to non-adherence. At this point, you know that you are at the current risks. So by the time you get to the current risks, there should be some answers that has already given you some current risks that are persistent. For example, if the patient is not taking her medications and has stopped taking the medications all of a sudden, there is a non-adherence or non-concordance to medication, which is a risk here. It can make, if the patient is not taking their medication, it can make a patient to relapse. Here, if the patient has told you that he takes alcohol and has been aggressive on 1 or 2 occasions to the husband and then the baby, then you can also look at the risks regarding the baby here. So risks to baby is also going to be a serious risk that you have to take into consideration. And then if the patient is not also sleeping, patient has not had sleep for the last 5 or 6 days, then that also becomes a risk here, because that is also going to go a long way to deteriorate the mental health of the patient. Then it's also stated clearly that the patient it does not even have appetite to eat. So here you also have to explore areas around her appetite to eat. How many days hasn't she has good food to eat? What is the reason why she's not eating? And that will give you a clear picture of in terms of nutrition, how that is also going. If the patient tells you that I only take energy drinks just to stay awake, I don't have any proper food, then you should know that clearly there is also a risk for malnutrition here. And then if the patient is not also taking care of in terms of self-care, then you can also talk about self-care deficit here. So these are the risks that you should be able to identify. Once you're talking to the patient and then the patient is giving you the answers, clearly there will be some risk factors that you should be able to identify here. So at the end, by the time you get to this point, by that time you have put down all the risks that you've been able to discover. So at the end, what you have to do is that you are now going to tell the patient his risks. So I have done this assessment with you through using the recovery model of care, and there are some risks that is persistent that I'm very much worried about. And these risks are, then you mention risks of malnutrition, risks of injury, all the risks that you were able to identify, you say it back to the patient. You let the patient know his or her risks. So if you go to the marking criteria, it is clearly stated that you let the patient know his or her risks. Then once the patient knows his or her risks, then you can come up to the last one, which is the capacity and consent. Even though capacity and consent is the first thing on this sheet, but it's actually the last thing that you are going to assess. So based on these risks, the focus here is that you are going to tell the patient his risks, and then you are going to see the patient view on that. whether the patient has insight into these risks and whether the patient will be able to manage these risks if the patient goes back to the community, or these risks goes beyond managing in the community, therefore the patient needs to be transferred to a mental health ward. Clearly some of the risks are there, like in terms of this patient who drinks and then is aggressive to the, has a history of being aggressive and hostile to the baby and then the husband. Clearly, if you're a mental health nurse, you are not going to allow this patient to go back to the community like that. No, you are going to suggest an admission to this particular patient in probably one of the mental health wards, so that this patient can have some form of treatment. So at this point, you make it clear to the patient that these are your risks. What do you think about it? And the patient will tell you, well, these are things that they are normal for me. I don't see the need for us to do anything because they are normal for me. All I need to do is to go back to my husband and then my wife, sorry, my husband and then my baby back home. If the patient gives you an answer like this, clearly the patient doesn't have any insight into his own mental health or into his or her risks. So at this point, you need to let the patient know that these are risks that cannot be managed in the community. Therefore, you want to suggest an admission to this particular patient. But when you are suggesting the admission, you don't suggest it plainly like that. You have to give reasons why you are suggesting the admission. So for example, if I am looking at it from the the aggressiveness point of view, that if I let this patient, if they discharge this patient back to his home, the symptoms is going to continue because already this patient is not adhering to his medication. So because of that, the patient has stopped. The patient has been hostile a couple of times to the baby and then the husband, because when she goes into the manic state, she takes alcohol. So clearly this is somebody who needs to be cared for. This is somebody who needs to be in the hospital for treatment to commence, for the person to get well. So at this point, I'll tell the patient that I'm very much worried about some of these risk factors, especially now that you have a baby in the house with your husband. You have been hostile on some occasions to this baby in your manic state. I know that is not what you want for your baby, but clearly this is a very difficult time for you. Based on this, it is clear that these risks, we cannot manage it when you go back to the community. So I want to suggest an admission, a short admission to you on the mental health ward. If you agree to this admission, we will try as much as possible to explain all aspects of your care to you on the so you here what you do is you pick the risk factors one after the other and you try to give some form of interventions to it. So for example, if the patient is non-adherent to medication, you let the patient know that medications um, can be of help to help relieve some of these symptoms. And if the patient or if she agrees to this admission, you would be referring her to the ward psychiatrist who will review her medications and put her on some medications that will be very, very, very helpful for her. That is, will be very, very helpful for her in managing her risks or in managing those symptoms that comes with the mania. Again, on the issues of sleep, this is what you'll be able to do for the patient. On the issues of injury, this is what you'll be able to do for the patient. So here clearly what you just do is that you pick the problems one after the other and then you give an intervention to it. If the patient is on the ward, interventions that you'll be able to give to that to curb those problems or those risk factors. You'll be able to bring those risks to some form of a minimal point. And at the end, it's more or less that you're trying to convince the patient to come in for the admission. And once you do that, at the end you ask the patient whether she is willing to accept for this admission to go on, so that this will be she's willing for this admission to go on, and most definitely the patient is going to say that yes, I think this admission will be good for me. And once the patient says that, you thank the patient, and then of course you let the patient know that you let the patient know the outcome of the assessment that you have done. You have come in, you spoke to the patient, you have explored her risks, these were her risks, and based on this risk, you felt that this risk cannot be managed in the community. Therefore, you've suggested an admission for her to be treated on the mental health ward, and she has agreed to that. And this is the outcome of it. And you're going to feed that back to the A&E team or the accident and emergency team to let them know the outcome of the assessment, so that immediately as possible she can be transferred to the mental health ward for treatment to commence. And then you ask the patient whether the patient has any questions for you. If the patient does not have any questions, then you can thank the patient, and then you will definitely end your assessment station. So at that point, you can say, assessor, I'll end my station here. Then you are going to do another hand rub according to the WHO guidelines, and then you just leave it there. And then basically that is it. You are done with your assessment. You are done with your assessment station. So it's mainly dependent on the scenario and what the patient will be telling you. And based on this, you are able to give your interventions, and you suggest the appropriate one for the patient. And it's as simple as that. So at this point, if you have any questions, you can put it in the comment section, and then I'll make sure that I would answer that. Collins is saying that thanks for the lecture, it's very helpful. I have my OSCE next week. Please, can I have your contact? I'll put my email in the section. Just email me, and then we can have a look at that. The mental health OSCE is not something that is difficult, especially when they have limited us to only mania and then depression, because there has a whole lot of mental health conditions that you could be asked to assess, but then NMC has just limited us to mania and then depression, which is very, very helpful for us. It makes sense though, because mania and then depression is something you can use 20 minutes to assess. But then if it is schizophrenia, or it is paranoid schizophrenia or psychosis, a lot goes into it. So it's going to take a whole lot of time to do assessment for that. So it just makes sense that they said we should just do depression and then mania. If you have any questions, you can pop it in the comment section, and then I'll make sure that I'll answer that. I'm still waiting for, I think 6 people are viewing. Most of the times, I think around this time, most people are not always online. So they are online at a point where around 10 thereabout, which will be too late for me here. And then this is a recorded version, so I will have people will come and watch it. The last time I did a live, after the live, a lot of people came down, or a lot of people came to watch it. Any other questions? If you have any other questions, you can just put it in the comment section. And thank you all for joining the live. I'm yet to upload more videos, and all those that have been emailing me, I've been seeing it. I have been seeing it, and then I've replied to all the emails. I've replied to all the emails. Yes, somebody was saying that, yeah, my channel is the only channel that does mental health OSCE. Yes, yes. So because of that, I need to do more of the videos. Um, yes. So any other, any other. If there are no questions, then I would just end it here. Oh, messages are popping on my screen. Yes. Thanks for the insightful. Thanks for the live call. I just thought I came late. Oh, sorry. Sorry that you came late. Yeah, sorry that you came late. I would be doing this more often. Um, I'll be coming online more often to mostly I just pick one of the stations and then we'll go through that. We'll have a discussion around that. And then I'll also currently I'm trying to set up a Google Teams. I'll be having sections on Google Teams as well. So that one we can be more interactive because you can all of us can be on video and then we can have a discussion around that. Yes. Yes. So if there are no questions, then I'll end it here. And then all those that are yet to take their mental health or ski, I wish you all the best. And if you have, it would be nice if we can have a practical aspect, just like depression. Yes, I'm doing a video on that. I did the video, but then I lost the audio. Yes, the guy that was the patient mistakenly offed his when I gave him the microphone to put on his shirt. I think he kind of mistakenly turned it off. So a whole video was recorded and then there was no audio. So just the video was just useless. I couldn't do a voiceover or anything over it because it needed to be practical. So because of that, I need to do a different one, and the guy I'm trying to find it. I'm finding it difficult to get him back to my place for us to do it. Yes, can we go through the professional and evidence-based values too? Yes, we can go through that. But as I've always said, the professional values and evidence-based, that one, um, it's more of you just have to read because if you don't read your marking criteria, there's no way. But then I can take you through that to show you how you'll be able to write out your answers. And there are some one or two things that you can also do to always remember the marking criteria. I already have two videos on, I think, social media and possible abuse also. I discussed, especially the first one, which was the social media, I kind of discussed how you would be able to remember the point so you can have a look at it. I already have it uploaded on my channel. Yes. There are no chat is coming in again, so I'll end it here. And then if you have any questions, I've put my email in the chat section. Just email me, and then I'll share my number with you there. I can't put my number here. I'll share my number with you there so that we can have a chat. All right. I wish you guys all the best, and I'll see you in my next section. Bye for now, and thank you for coming.